Welcome back. Here at Liftoff, we are advocates for celebrating diversity and individuality, as is our next guest. Dr. Elie Levine is one of New York's top board certified plastic surgeons. His expertise includes all areas of plastic and reconstructive surgery, including gender affirmation surgeries. He joins us to educate us further. Welcome, doctor.
Thanks for having me.
I'm so excited to have you on the show because this is a conversation that's near and dear to my family. And tell me a little bit more about the increase in gender affirmation surgeries in general.
So I think that over the last few years, there's definitely been a confidence from a patient standpoint to seek out opportunities to really help themselves. And I think that uh, as the world kind of is a little more accepting to people, uh, people are a little bit more open about what they're seeking out. So instead of being hesitant, they're embracing what opportunities they have for themselves.
And do you see the request for gender affirmation surgeries being more predominant in a certain age group or older adults seeking gender affirmation, or is it across the board?
I think it's across the board. I would say that the largest, I'd say, recent increase would be in older. When I say older, I mean relatively older. I'd say over the age of 40.
Hey, watch it.
Exactly, exactly. Uh, but across the board in general.
Interesting. So, when we talk about gender affirmation for all of our listeners out there, a lot of people think that that just means bottom surgery changes. And you're known for so much more that comes along with gender affirmation, including artistic eye procedures for the face, different body, even hairline procedures. Tell us a little more about what gender affirmation surgery actually spans and covers.
You're absolutely right. It covers really from head to toe. And so when you work from the top down, the hairline varies very differently from people. And people have ideal goals of what they're seeking out in terms of their hairline. Uh, Nose shape, size, cheekbones, eyes, both in terms of shape as well as overall contour, jaw lines, neck lines, all of these things come into play. And there are a lot of different procedures that are used in a lot of areas of aesthetics that can really be utilized here to really help people. Uh, and then, of course, top surgery, chest surgery is also a significant player. And then overall kind of body contouring, waistline shaping, um, everything from your arms to your chest to your belly to your waistline to your thighs. All these things really come into play. And so sometimes it's really looking at what part of the journey people are on and where they're really seeking out to, what are the things that particularly they notice about themselves that they want to help. And that's where to me, a lot of the excitement in my line of work is a ability to really help people in so many different ways.
Thank you so much, Dr. Levine, for being on the show, for the work that you're doing, and for being on Liftoff. We'll be back after the break with our friend and our expert in the beauty industry, CEO of LEAD, Rolfs Global Institute, Francis Tesmer. So stay with us.